Top 25 Pharmacist Interview Questions and Answers. In the competitive field of pharmacy, preparing for an interview is crucial for success. This video will guide you through the top 25 questions commonly asked during pharmacist interviews, along with effective answers to help you stand out. By understanding these key questions and responses, you can boost your confidence and showcase your qualifications. Whether you're a recent graduate or an experienced professional, this resource aims to enhance your interview readiness and overall performance. 1. Why did you choose to become a pharmacist? Becoming a pharmacist was driven by my passion for healthcare and helping others. I have always been fascinated by the science of medications and their impact on patient health. Interacting with patients and making a difference in their lives through medication management excites me. The pharmacist's role as a medication expert allows me to educate patients about their prescriptions, ensuring they understand their treatment plans. This profession combines my interests in science, patient care, and community service, making it a fulfilling career choice for me. 2. What do you consider the most important role of a pharmacist? The most important role of a pharmacist is to ensure patient safety while optimizing medication therapy. Pharmacists are vital in assessing medication regimens, identifying potential drug interactions, and providing education to patients about their medications. By collaborating with healthcare providers, pharmacists can tailor treatments to individual needs, thus enhancing therapeutic outcomes. Additionally, they play a crucial part in monitoring patients for adverse effects and ensuring adherence to prescribed therapies. This comprehensive care fosters trust and improves health outcomes within the community. 3. How do you stay updated with the latest developments in pharmacy? Staying updated with the latest developments in pharmacy requires a multifaceted approach. I regularly read reputable pharmacy journals, subscribe to newsletters, and follow professional organizations online. Attending conferences and workshops allows me to engage with peers and learn from experts in the field. I also participate in continuing education courses, which are essential for maintaining licensure and enhancing my knowledge. Networking with colleagues and discussing recent advancements helps me gain different perspectives on emerging trends and best practices in patient care. 4. Describe a time you identified a medication error. How did you handle it? During my time at the pharmacy, I noticed that a patient was prescribed a dosage of a medication that was significantly higher than the standard recommendation. I immediately cross-referenced the patient's medical history and the prescribing information. After confirming the error, I contacted the prescribing physician to discuss my findings. We were able to clarify the correct dosage, and I informed the patient about the potential risks. By taking prompt action, I ensured that the patient received safe and effective care while also preventing possible adverse effects from an incorrect dosage. 5. How do you handle a high-pressure work environment? In a high-pressure work environment, I prioritize effective time management and clear communication. I break down tasks into manageable steps while focusing on critical priorities to ensure that patient care is never compromised. I remain calm and composed, using deep breathing techniques to maintain focus. Collaboration with colleagues is essential. We support each other during busy times. Regular breaks help me recharge and stay alert. I also find it beneficial to reflect on past experiences to identify successful strategies, allowing me to adapt and improve continuously in stressful situations. 6. What steps do you take to ensure patient safety when dispensing medications? Ensuring patient safety is paramount when dispensing medications. First, I carefully verify the prescription details, including the patient's name, medication name, dosage, and administration instructions. I cross-check the patient's medication history for potential drug interactions or allergies. Additionally, I perform a final check before handing over the medication, confirming the label matches the prescribed instructions. I also counsel patients on proper usage, potential side effects, and storage information. Regular training and staying updated on best practices further enhance my ability to maintain safety standards. 7. How do you handle a situation where a patient disagrees with your advice? When a patient disagrees with my advice, I first ensure that I listen actively to their concerns. Understanding their perspective is crucial. I provide clear explanations for my recommendations, including the rationale and any relevant evidence. If the patient remains unconvinced, I encourage open dialogue, allowing them to express their feelings and preferences. I respect their autonomy and offer alternative options when appropriate. Ultimately, my goal is to foster a collaborative relationship where the patient feels heard and empowered to make informed decisions about their health. 8. Describe your experience with pharmacy software systems. In my previous roles, I have worked extensively with various pharmacy software systems, including Pioneer RX and QS1. I have utilized these platforms for managing inventory, processing prescriptions, and ensuring accurate patient records. My experience includes training new staff on system functionalities and troubleshooting any issues that arise. I understand the importance of data integrity and have developed skills in using software to enhance workflow efficiency. Additionally, I have participated in software upgrades, providing feedback to improve user experience and streamline operations. This experience has equipped me with the technical proficiency necessary for effective pharmacy management. 9. How do you prioritize tasks when the pharmacy is busy? In a busy pharmacy, I prioritize tasks by assessing urgency and impact on patient care. First, I address prescriptions that are time-sensitive or for patients with immediate needs. I use a triage approach, determining which tasks require immediate attention and which can be delegated. Communication with team members is vital. I make sure everyone is aware of pressing tasks. Additionally, I utilize pharmacy software to streamline workflow, ensuring that we maintain efficiency without compromising accuracy. This organized method helps manage the workload effectively and enhances patient satisfaction. 10. What would you do if a prescription seems incorrect or unsafe? When I encounter a prescription that appears incorrect or unsafe, my first step would be to verify the details with the prescribing physician or healthcare provider. I would carefully review the patient's medication history and assess any potential interactions or contraindications. While waiting for clarification, I would ensure that the patient is informed about the situation and advise them not to take the medication until it is confirmed to be safe. Patient safety is my top priority, and communication with both the patient and healthcare provider is essential in resolving any discrepancies effectively. 11. How do you counsel patients on new medications? When counseling patients on new medications, I start by discussing the purpose of the medication and its expected effects. I ensure they understand the dosage, administration route, and timing for taking the medication. I also explain potential side effects and what symptoms they should monitor for. Encouraging patients to ask questions is crucial, as it helps clarify any doubts. Additionally, I provide written information, including a medication guide, to reinforce understanding. I emphasize the importance of adherence and encourage them to reach out if they have any concerns or experience adverse effects. 12. Describe your experience with compounding medications. Compounding medications involved preparing customized dosages for patients with specific needs. I gained hands-on experience during my internship at a community pharmacy, where I assisted in formulating compounds such as creams, ointments, and oral solutions. This experience enhanced my understanding of different formulation techniques and the importance of patient-specific adjustments. I also learned to ensure compliance with safety standards and regulations, which is crucial in maintaining quality. My attention to detail and commitment to patient care drive my passion for compounding, allowing me to contribute significantly to individualized patient therapy. 13. How do you handle confidential patient information? Handling confidential patient information is a critical aspect of pharmacy practice. I ensure that I follow HIPAA regulations and maintain strict confidentiality by safeguarding patient records and discussing sensitive information only in private settings. I use secure methods for electronic communication and make sure that any physical documents are stored in locked areas. Regular training sessions on privacy practices help reinforce the importance of confidentiality among staff. I encourage patients to voice any concerns regarding their information, ensuring they feel secure and respected in the pharmacy environment. 14. What strategies do you use to prevent drug interactions? To prevent drug interactions, I implement several strategies. First, I conduct a thorough medication review for each patient, assessing their complete medication history, including over-the-counter drugs and supplements. I make use of pharmacy software that flags potential interactions, allowing for immediate intervention. Educating patients about their medications is crucial, so I explain the importance of disclosing all substances they are taking. Regular communication with healthcare providers also helps ensure that all parties are aware of the patient's regimen, further minimizing the risk of interactions. 15. How do you deal with difficult or angry customers? Dealing with difficult or angry customers requires patience and effective communication skills. I first listen actively to their concerns without interrupting, allowing them to express their feelings. Recognizing their frustration is crucial, so I validate their emotions. After understanding the issue, I calmly explain the steps I can take to resolve it and provide solutions. If necessary, I involve a supervisor to ensure the customer feels heard and supported. My goal is to turn a negative experience into a positive one, fostering trust and maintaining their loyalty. 16. What experience do you have with insurance and billing issues? I have worked extensively with insurance processes during my pharmacy internships and professional experiences. This included verifying patient insurance coverage, processing claims, and addressing billing discrepancies. I have navigated various insurance databases, ensuring that prescriptions are properly covered and that patients understand their copays. When issues arise, I communicate directly with insurance representatives to resolve problems promptly. This experience has enhanced my ability to advocate for patients and ensure they receive the medications they need without unnecessary financial burdens. 17. How do you ensure accuracy when filling prescriptions? Ensuring accuracy when filling prescriptions is crucial for patient safety. I meticulously verify each prescription by cross-checking the patient's information, medication details, and dosage against the original prescription. I also utilize pharmacy software systems to flag potential errors and interactions. Additionally, I perform a final check before dispensing, ensuring that all labels are correct and clear. Engaging in regular communication with healthcare providers helps clarify any discrepancies, and I encourage an environment where my team feels comfortable discussing concerns or questions about prescriptions. 18. Describe a time you went above and beyond for a patient. During my time at the pharmacy, I encountered a patient who was struggling to afford their medication. After discussing their situation, I took the initiative to contact the prescribing physician to explore alternative, more affordable options. I also researched patient assistance programs and provided the patient with information on how to apply. Additionally, I arranged for a follow-up call to ensure they had successfully obtained their medication. Seeing the patient's relief and gratitude made the effort worthwhile, as I knew I had made a tangible difference in their health and well-being. 19. How do you handle a situation where a drug is out of stock? When a drug is out of stock, I first check the inventory system to confirm its status. If it is indeed unavailable, I inform the patient of the situation and discuss alternative options, such as a different medication or a generic equivalent. I also offer to contact the prescribing physician for approval if needed. Additionally, I provide the patient with an estimated time frame for when the medication might be back in stock or help them locate it at another pharmacy. Clear communication and ensuring patient care remain my top priorities in such situations. 20. What do you think are the biggest challenges in pharmacy today? One of the most significant challenges in pharmacy today is the increasing complexity of medication therapy management. With the rise of polypharmacy, pharmacists must navigate potential drug interactions and side effects while ensuring optimal patient outcomes. Additionally, the evolving regulatory landscape places demands on pharmacists to stay compliant while managing their workflow efficiently. Another challenge is addressing health disparities, as pharmacists strive to provide equitable care to diverse populations. Lastly, the integration of technology, while beneficial, can lead to communication barriers and requires continuous training to utilize effectively. 21. How do you educate patients about proper medication adherence? To educate patients about proper medication adherence, I start by explaining the importance of taking medications as prescribed. I use simple language and provide clear instructions on dosage, timing, and potential side effects. Visual aids like pill organizers or charts can help patients understand their regimen better. I encourage patients to ask questions and actively participate in their treatment plans. Follow-ups through phone calls or messages can reinforce adherence and address any concerns. Building a trusting relationship allows patients to feel comfortable discussing their challenges with medication. 22. What qualities make a great pharmacist? A great pharmacist embodies several essential qualities, including strong communication skills, empathy, and attention to detail. Effective communication ensures clear dialogue with patients and healthcare providers, fostering trust and understanding. Empathy allows pharmacists to connect with patients on a personal level, addressing their concerns and promoting adherence to medication regimens. Attention to detail is crucial for accuracy in dispensing medications and identifying potential drug interactions. Additionally, a commitment to lifelong learning keeps pharmacists updated with evolving practices, enhancing their ability to provide exceptional care. 23. How do you handle multitasking in a fast-paced pharmacy? In a fast-paced pharmacy, I prioritize tasks by assessing urgency and impact on patient care. I create a mental checklist and focus on one task at a time while keeping an eye on incoming requests. Effective communication with colleagues is essential. I delegate responsibilities when possible to ensure efficiency. I utilize organizational tools such as timers and reminders to stay on track. Staying calm under pressure allows me to manage multiple tasks without compromising accuracy or patient safety. Continuous training in time management techniques further enhances my multitasking abilities. 24. Describe your experience with immunizations, if any. I have had extensive experience administering immunizations throughout my pharmacy career. I completed a certification program that equipped me with the necessary skills and knowledge to provide various vaccines, including flu shots, pneumococcal vaccines, and COVID-19 immunizations. During immunization campaigns, I engaged with patients to educate them on vaccine benefits and address any concerns. My role involved not only administering the vaccines but also maintaining accurate records and ensuring compliance with local health regulations. This experience reinforced my commitment to patient care and public health. 25. Where do you see yourself in your pharmacy career in 5 years? In 5 years, I envision myself advancing within my pharmacy career by taking on a leadership role, possibly as a pharmacy manager or clinical pharmacist. I aim to enhance my expertise through continuous education and specialization in areas such as pharmacotherapy or medication management. I also see myself actively participating in community outreach programs to promote health and wellness. Building strong relationships with patients and healthcare providers will be crucial in my journey, allowing me to contribute positively to patient care and medication safety initiatives. In this video, we explored the top 25 pharmacist interview questions and provided detailed answers to help you prepare for your next interview. Mastering these questions can significantly boost your confidence and improve your chances of landing that coveted position in the pharmacy field. Remember, preparation is key, and understanding the expected responses will make you stand out to potential employers. If you found this content valuable, please like the video and subscribe to our channel for more insightful career tips and guidance. Thank you for watching.